So we aimed to perform a head-to-head comparison of a ticagrelor versus a prasrugrel-based strategy in acute coronary syndromes undergoing invasive evaluation. That is to undergo coronary angiography. And in terms of background, we had two ADP receptor blockers, which had both a class 1 recommendation, but the relative merits, they were really unknown. ISAR-REACT 5 was an investigator-initiated, randomized, multi-center open-label trial. Patients were enrolled in 23 centers, 21 in Germany and 2 in Italy. We included patients that were hospitalized for an acute coronary syndrome and were planned to undergo coronary angiography. We excluded patients that had active bleeding, need for oral anticoagulation, renal insufficiency requiring dialysis, moderate or severe hepatic dysfunction, concomitant therapy with cytochrome P83 inhibitors, inductors, or substrate with a narrow therapeutic index. So these were just the main inclusion and exclusion criteria. The number of patients that we enrolled was 4,018, and these were randomly assigned to either a prasrugrel or a ticagrelor-based strategy in a one-to-one fashion. And the main finding was that the primary endpoint, which was the composite endpoint of death, myocardial infarction, or stroke at 1 year after randomization, was significantly reduced with a prasrugrel-based strategy. I'm not in the guideline committee, but I'm sure this will cause a lot of discussion. And for me, the data are convincing that the prasrugrel-based strategy is superior to a ticagrelor-based strategy and should therefore be preferred in clinical practice. At least in the patients that we analyzed, in ACS patients with invasive evaluation, a prasrugrel-based strategy should be preferred. Importantly, the increased efficacy with prasrugrel did not come at the expense of an increased bleeding risk. So bleeding was not increased with prasrugrel. I think we found a very convincing and robust result of superior efficacy of prasrugrel over ticagrelor. Of course, the trial has limitations like its open label design, but we did our best to overcome it, for example, by evaluation of each endpoint event by 2 event education committee members that were completely blinded for treatment assignment.